cannot believe we are at week 6. All of the previous 5 weeks are available on the Unite for Her website. You can use the QR code to the left or to the right of me to access any of the previous weeks or this week. This week, I started with a protocol week 1 that was for fatigue, and I'm ending the 6 weeks with a protocol for insomnia and anxiety. And I think both of the protocols are helpful for really helping people feel grounded. And both are really good for before bed. So look back to week 1, try this protocol and see which one is more helpful. But both are good for helping people go to sleep and helping when you have racing thoughts or worries, or you feel stuck and not sure what thing to do first. So I give these 2 protocols all the time for people. I tried to pare down, before I go into this, how many points. So we'll see how long this protocol takes. As far as acupressure protocols, so for people that are brand new, quick recap for those that have already listened to a couple of these. Acupressure is using pressure instead of acupuncture needles to deliver stimulation to acupuncture points. Find a place that's comfortable for you. I've done a couple weeks where I'm sitting in a chair and a few weeks where I'm sitting on the floor. I also have people who do these protocols while lying on their backs in bed or in a comfortable recliner, whatever works for you, as long as it's a place where you can focus and relax. We want the pressure to be applied to the points for about 1 to 2 minutes unilaterally, meaning focus on one point, left side, right side, left side, but only one point at a time. Okay. Pressure should be even, not too heavy, not too light. Most of the points you're doing direct, even pressure without movement. I have noted week to week if there's a particular point where massaging in a direction might be helpful for you. You can use a thumb, a finger. I have a pencil this week. Pencils are helpful. Just make sure it's got a nice little nubby eraser. You can also use another person if it's to an area where you can't reach, like if it's the feet or something like that, or if your shoulder can't get to the back. We have 1 point back here this week. Just have somebody help out. If you need a thicker eraser, you can get one of those, they stick on top, and that makes like a bigger, it's like almost finger sized. I have patients that really like those too. But either way, comfy place, comfy position, pressure 1 to 2 minutes per point. And then we try to do this once a day, every day, as long as you have symptoms. Previous weeks, we've done protocols for things that are more acute, like nausea. In that case, I would say to a person, do the protocol when you have the symptom. Headache, nausea, do it when you have the symptom, either along with or instead of once daily. For something like this, along with week 1, I would say find a time maybe before bed that you can do the protocol and see if it's helpful for you. Okay. I put together a few points. I tend to start top to bottom, upper extremities, and then lower extremities. So today we're actually going to start behind the neck. So gallbladder 20 is, if you go to the ear and then you go down into the neck, there's like a little triangular nook right where the muscles of the neck attach. I'm going to turn around. Right where the muscles of the neck attach. So there's like this little area that you can grab on, and then you're going right in here. It's usually tender. Let's start on one side. I'm going to start on the left side. We're going to do 2 minutes. I'm sorry, I'm starting on the right side. We're going to do 2 minutes on the right side, 2 minutes on the left side. Gallbladder 20. The visual that one of my teachers gave was it's like lifting, like you have a boiling pot of water and you lift the lid off and all the steam escapes. So it's a very grounding point, but it's also a very good point for releasing pent up heat in the case of hot flashes, racing thoughts in the case of anxiety or insomnia, anger, emotions. It's one of those points that sometimes after we needle it, patients feel like an emotional release. It's a really important, powerful point. And if you feel like doing this point one side at a time feels too unilateral, this is one of those points where if you can reach both sides, you're more than welcome to. But typically we do acupressure on one side at a time. I'm getting sweaty as I do this point. I'm going to switch sides. Same thing on this side. You're going to come here over the mastoid bone, which is that little triangular bone behind your ear, and then right into the muscular nook, right where that neck muscle comes up, where there's like a little bit of a tender spot. You might get some referral soreness up into the back of the head. It might also go down into your upper traps, that area. You might also getting some good neck clicks. I'm using my index finger. You could use a thumb, probably more like that maybe, if that's more comfortable, like a flat palm of your thumb. Or you can also go back here. I don't like that as much for this point though, because it feels a little uncomfortable. I think a finger or thumb. Okay, now from this point, the next one is do 14. So do 14, and I'm not flipped around behind, but if you palpate your back, it's the first time I've done a point that's on the back. If you palpate your spine in the center of your back, so follow your cervicals, your neck spine, all the way down, you feel like a big bump there. You're going right below that bump and you're pressing or massaging it. And you can do direct pressure on it. You can also do pressure that rocks back and forth. So I'm doing like this motion back and forth on the point. Do 14. I also have people that do like this type of movement too. So you can go side to side or this type of movement, whatever feels comfortable for you. But you're following it down, that little bump. It's right at the base of the cervical spine. We use this point. It's called release the exterior. It's good at inducing, like helping with lowering fever, helping with hot flashes, But I think, especially with women, we hold a lot of tension in our upper back, and especially after, all the surgical interventions that happen in the breast area. It's a really good point to just help release tension in the upper back, physical and emotional. There's another point that's lateral to that, so on either side of that, right in here, that if do14 is uncomfortable for you, that one is sometimes an easier one for people to do. So for that one, you're grabbing, let me keep my little guy there. You're going right between the edge of the shoulder blade and the spine. It's usually you can grab it like that, and you can try that too. And just if you do that on either side. So do one left side, right side, unilaterally. And I'm happy to update this. I should probably update the slide for that. Just another minute on this one. Okay. Now, as we come down, so neck, center, or the lateral point. The next one I like after this is kidney 27. So for that one, you're going right in. You can see where my sternum is, going right there. And then you're going out like two, I can't do it straight to myself, like 2 finger breaths out here. And then you're pressing there. And all of these points are giving me a hot flash today. All right, I'm going to start on one side. Kidney 27 is a very downward moving point. It's the end of the kidney channel. And the kidney channel comes all down the front of the breast, down the front of the body. It's a really good point for just sending the energy down and settling the body before you go to sleep. If you have a port on any side, I would just watch. Acupressure is fine. We don't typically needle where there's a port, but acupressure is fine as long as it's comfortable for you. So maybe on the side with the port, just do more intentional pressure. So hand here, like flat hands, not really pressure, but just setting it here, not really digging in with a finger, if that makes sense. And then do regular acupressure for the side that doesn't have a port. I think this is the first point in 6 weeks that's in this area. I'm going to switch sides. So same thing, you're finding sternum And then you're coming like 2 fingers out. So like about that different. And then you're pressing. And I know I'm talking through, I think each of these weeks I'm doing a lot of talking. Feel free to, if you're doing one of these on a daily basis, once you learn the points, feel free to mute me and just go through the points in a more relaxed manner. For those of you that do get hot flashes, you might notice that with the acupressure, as you start, you get like one big one, and then everything settles after that. That's totally normal. Okay, so back here, 1 on both sides, 2, 3. Now let's move to the wrist. So I have 2 points on the wrist that I'd like to do. I'd like to do pericardium 7. And I'd also like to do heart 6. So we're going to start on one side. Pericardium 7 is right in the middle of the wrist, right at the wrist crease. Press right there, and you can, wherever it's comfortable, move this down a little bit. So refining the wrist. And then I like to press that way. So then it doesn't feel like you're tweaking the tendon. I'm going to switch to the other side. Each of these points is anchoring a different channel in the chest. So the pericardium channel starts up by the breast, right outside of the nipple, and then it comes up down the inside of the arm. So as you're pressing, you can visualize just anchoring from that area. And I'm just pressing again, right where the wrist crease is, and down. This one, you might get some tingly numbness into the palm, especially if you have a little bit of neuropathy. Totally normal. Just adjust your pressure for comfort. It's not a no pain, no gain situation. Going to do the other point on the wrist. So we were pericardium 7. We're going to go out by the pinky. So just roll right over like a little tendon there. We're going right there and then up just a little bit. Usually there's a little nook there and it's a little spot that's tender. So heart 7, it's like 4 points right next to each other. Heart 7 is right there at the crease. Heart 6 is like just maybe half an inch from heart 7. And then we're doing acupressure there. Honestly, you can't go wrong if you find just the area that's tender on that side. This point, so heart channel, starts actually in the armpit. So that feeling of tension that a lot of women have raising their arms post-surgically or post-biopsy, this channel can be really helpful to treat cording, things like that. Heart 6 is also indicated for sweating and anxiety. Basically anything that makes you feel like you're going up. And I'm putting my hand like this because it's comfortable, but you can do what's best for you. You could rotate it down, whatever works for you. I always find this point to be really calming. Okay, let's switch sides. So pericardium 7 on both sides, heart 6 on this side, heart 6 on the other side. So same thing. Heart 7 is right at the wrist crease. Heart 6 is like a little nook you roll over, and it's like right there. And you could use an eraser if you needed to. Okay, so this side you could do that. Maybe bend your wrist a little bit if it's more comfortable. And I don't know about you, but in acupressure protocols, I find that this is about the moment where things start to settle. It's usually a few points in. But by the time I get to the wrist points, I feel calmer, less sweaty, less emotional. And a little more grounded. No sense of time though. Okay. That's it for upper extremity. Now, lower extremity, I have 2 points. We've done stomach 36 before. It's right up here. I'm going to try. I'm in shorts today. I'm going to try to do this. So stomach 36, as you come up, coming right into this spot. So you've got the tibia coming up. It's that shin bone. It starts to make like a triangle. You're going right here on this side. You can hold pressure for that one. Mm-hmm. And then you can switch to the other one. We'll do a minute for each of these. So same thing on the other side. Coming up, going up the shin bone. It's not quite where the eye of the knee is. It's down a little bit. It's not lateral out here. It's like right off of the shin bone. And then we're pressing. You can also do stomach 36 with this point too. Might actually be helpful to use pencil. I don't know if you can see down here. I don't think you can see with the table. Stomach 36, so the stomach channel itself comes all the way up. So the kidney channel is the inner line, and then the stomach channel is the outer line. So we're picking two channels on the front that have, one has an upward movement, one has a downward movement. The stomach channel is a downward movement. Just like if you're chewing food, it goes down your esophagus, down through your digestive tract, down. Stomach channel is the same way. Okay. Last point is on the inside, kidney 7. It's on the inside of the leg. Let's see if I can get, yeah, there we go. Okay, so you're coming on the inside of the bone. So you're going over, so we were on the tibia on this side. Now we're rolling over it on the inside of the leg. You've got your inner ankle bone. You're going just off of it. Right above, maybe like right up here. So you're going to roll over the ankle bone and go right into the nook between the Achilles tendon and the bone. It's usually pretty tender on women. And then pressing. You could certainly, it's a very sharp pencil. You could certainly use a pencil eraser on it as well. And just nice even pressure. This one, in combination with this one, is very good at just bringing everything down and grounding. We use it a lot for anxiety, panic attacks, things like that. So kidney 27 combined with kidney 7. Sometimes we add a point in here too, but we're not doing that one today. Okay, so other point. Let me see. We're coming up on the ankle bone on the inside. And then going. It's not a great angle. And if you were lying down on your back, I would just bring your leg up to where you can get your finger or thumb into it. If that's comfortable, you also could have someone press it for you. We'll hold this one for a minute. We've done spleen 6 in previous weeks. So spleen 6 is 1 more inch up along the inside. Also usually tender, but we want to do the lower point in case you get those two confused. So kidney 7 is more towards the ankle than spleen 6. Okay. And I know I'm going to be running over a little bit on time, but still gauging how many points I can put in, 20 minutes. Okay. As we come to a close, I put in the last slide, because I know this is our last week, I put my information. You have the resources on the website. The QR code here is also to my website. You have my contact information. It's been a pleasure these last 6 weeks, and I hope you find it to be helpful. And if you have any questions, feel free to reach out.